with a video. It's a demonstration. And this is Landaverde.
Por favor, no valoren más lo económico que la vida. Si ellos están valorando más lo económico que la vida, eso es pecado. Nosotros venimos este día aquí a pedirles semana a todos los médicos para la vida de Ansell, la de Lorenzo, la de Marcela, la de Jorge Mariscal, la de Marcos Cruz y muchos otros emigrantes que están siendo condenados por el único hecho de no tener documentos. Y el que se pronuncia más en favor del dinero y no en favor de la vida está cometiendo un pecado. Y nosotros venimos a pedirle a Roche que atienda inmediatamente a Ansell, a Arroyo y a toda esta familia, y le venimos a pedir posada como lo hizo María. Venimos a pronunciarlo en favor de la vida y no en favor de lo material. Y el mensaje es claro, que queremos que ellos sean atendidos inmediatamente porque están a punto de perder la vida.
Get them assessed. Now, if they need outpatient care, we're going to have to work that out. And they could be seen somewhere else, and we could talk to the doctors at Cook County. Okay. All right. I always like to start with a little story. So my name's David Ansell. I work at Rush. And what my title is now is a new title. I'm the Senior Vice President for Community Health and Equity, which is a new concept at Rush. At the time, I'll tell you the story of this, I was Chief Medical Officer. And I'll tell you more about that in a second, but first I want to sort of frame what this panel is about. So we've had a day of public health and epidemiology and talking about the causes of the causes. And many of you are students or faculty or researchers in public health, and you work in the realm of ideas. And we're ending today around with the idea of sort of the role of activism in achieving health equity. And I want to just introduce the panel. I'm going to tell you a little bit more about my introduction to this, and then we're going to hear about, these are about Chicago-based activists who have done very, very specific work on health justice. So maybe the three of you can just introduce yourselves and to the group and your organization.
Sure. Hi everybody, my name is Alex Goldenberg. I work with a group called STOP, which stands for Southside Together Organizing for Power. It's based in Woodlawn and surrounding neighborhoods on the south side.
Hi, I am Jose Landaverde. I am with the Faith, Life and Hope Mission and with the Diocese of Quincy, but a community organizer in Chicago for about 27 years.
I'm Washington. I'm retired, man. I'm the pastor emeritus, I think that's the word it's on. Where my wife is now the pastor of the Little Summer, which Lincoln United Methodist and Albuquerque Methodist. And part of our ministry is the Family Community Union, my parish ministry, and that includes the youth health service school. Talk a little bit about it.
All right, that video was, I got an email that there was going to be a demonstration at Rush, and it was going to be undocumented individuals, and it was on a Saturday before Saturday, December 24th, 2011, and it was a posada, and being just basically ignorant and Jewish, I had to look it up. And the story of posada, let me get this right, is that, posada is shelter, and Mary and Joseph, looking for a place to deliver baby Jesus, went to all these different places. And in a tradition, for December 16th to the 24th, there's caroling, you go to people's houses, and on the 24th, the doors open to the church, and you have a little party, and you celebrate the birth of Jesus and the fact that one kind person actually provided shelter. It wasn't the best shelter, it wasn't in the house. So I knew that they were coming to Rush, and so I decided to show up, and it was a demonstration asking for the most expensive treatment known to humankind, transplants for the undocumented. And the story will go from there, and Father Landaverde will tell it. But I'm going to start this by just asking each of you to briefly talk about sort of the role of your organization in health activism, and why you chose healthcare as the thing to focus on, and what was the focus of your efforts? Because we just wanted to just go through. And
Sure. I got involved with STOP when I was a student at the University of Chicago. Not from Chicago, from Miami, and came there to study, and was interested in activism. My mom is Cuban and kind of grew up learning about the revolution and had these romantic ideas. And while I was a student, there were some people who were learning about the role of the university in pushing out people who lived just south of the university as it was expanding. This was the time when the housing bubble was really heating up, 2004, and we had got word that there was a 500-unit housing project that the university wanted to purchase and demolish. And actually found a copy of a plan that showed that that's what they wanted to do. And
so the University of Chicago wanted to do that?
Oh my God.
It was actually thanks to some student who was interning in the admin office who had this photocopied PowerPoint presentation that the board had seen, which showed they wanted to turn this project into stores like the Gap and different things, which kind of places it to 2004. So armed with that, we started knocking on the doors of the residents and worked with them to build up a tenant council, which took their demand to stay in their housing to the university, and they ultimately won. And from that, STOP expanded and kind of became a force fighting for low-income housing to stay in the neighborhood. And as we started building relationships with people, some of them started bringing up in these meetings that the mental health clinic down the street was threatened with being closed, the city's mental health clinic. And they were basically saying, what good is having my house here if my clinic is closed? This is really just another way of pushing me out of the neighborhood. And the energy that they brought to that fight is what pushed us to be a single issue housing group to become a multi-issue housing and healthcare organization. And the same is true of how we started getting into the trauma work. We had built a youth organization to work with the young people who lived in the housing we were working in. And one of the first leaders and co-founders of the group was tragically shot right on 61st and Cottage Grove, just 2 blocks south of the University of Chicago, driven past the university to Northwestern on the northern edge of downtown, where he passed away. And so the young people were thinking about, why that happened, started learning about the lack of resources that were invested in the South Side, that there was in fact no trauma centers on the South Side, and thought, what better way to honor his legacy than to fight to change some of the reasons that led to his passing, and fight for that investment in the South Side. So that's how and why we mounted the fight for trauma care on the South Side.
Oh, fantastic. I think you'll talk about Fearless leading the youth a little bit. Just say a little bit about the youth and the youth organization.
So, and that's the sons and daughters of the folks that were living in the housing we were organizing, formed their own youth organization called Fearless Living by the Youth, which consisted of young people who at first started organizing around juvenile detention and the poor conditions that were happening in the detention center. Some of their friends were coming back into the community and telling stories of inhumane conditions. And so the young man who was shot was Damian Turner. He was one of the leaders of that fight. And so the group was really built up around that. And when he was killed and they started the Trauma Center campaign, those same young people who had already been activated around juvenile justice reform were already participating in housing issues. They were already coming to a few actions to save the clinics. It didn't take any kind of consciousness raising or any real big step to say now it's time to take on healthcare justice fights as well. And so I think, and the whole campaign has always been youth-led. So the young people who were the most impacted by the lack of trauma care were the ones who were always leading the fight and leading us. The spokespeople at the actions, they were in the strategy sessions deciding on what activities to take on. And that's really kind of been the approach that we take at STOP, really trying to ensure that those most impacted are leading the efforts.
Is the trauma center still in the works, and is the plan happening?
Yeah, so I guess to spoiler, we won the campaign. And after a 5-year-long struggle, we succeeded in getting the University of Chicago to completely take a 180 and commit to opening up a trauma center on the south side. It should be open in about 1.5 years. And so we're still fighting to ensure that they actually follow through on the commitment, but also that there's community input in the programming that happens at the trauma center. So we're very concerned about the social services that come with the trauma center, the quality of aftercare and access to it. And so we're really fighting to have a seat at the table to impact those decisions.
Thank you. Father.
Well, I am Jose Landaverde, and how we get involved in all of this. Well, I've been in Chicago for about 40 years and community organizer for about 26 years. I don't remember when, but my community organizer was always fighting against police repression, police brutality, and immigration rights, and being a priest also in Little Village. But when I was in Little Village, we were working to stop police brutality and also the persecution of immigrants by the police, organizing against the polymigrant that we call in Chicago. But one day at 8 o'clock in the morning, I was sitting in the church opening when one guy showed up, and he was almost walking, and he said, I want to talk to you. And I said, why do you want to talk to me? He said, because I am going to die. And I said, why are you going to die? We have a tradition that give the communion and pray when somebody will die. He said, I want to receive the communion because I'm going to die. And then I asked him, why are you going to die? And he said, because I need a transplant, and I am undocumented, and nobody will do my transplant. I just went to Rush Medical Center, and the lady out there told me that I don't have a documents, that I will die because they will not do a transplant. And I went to Northwestern University, UIC, and they said to me the same thing, and I am almost dying. And after him, another 3 more, the same situation. And then I told this guy, Elfego, that was Elfego, you're not going to die, we're going to fight. I'm not going to give it to you, the communion, because this is not going to save his life. We're going to fight. Because those hospitals are doing something wrong. They are doing, they are healthcare workers, but they are not, they are unethical, because they are putting money over people's lives. Life is coming. We're gonna We're gonna do whatever it takes, but we're gonna take it over Roche Medical Center. We're gonna infiltrate the hospital. And we're gonna do it. And then we did a plan for December 24. To do it was December 24. We did 2 plans, and then we decided to do in 2 scales.
Can I correct something?
Yeah. Go ahead.
So I get this email from actually Reverend Coleman's wife, the minister now.
Coleman,
And she says-
You were infiltrating us.
And the email says, I'm seeing patients, it's Friday, December 23rd. Everyone's gone because it's Christmas. And I get an email, heads up, doc. And it sends me the pamphlet. And she goes into a huge thing, including accusing Steve Rothschild, who's back there, promising something. And she says, you know, I guess that's what Rush gets for blowing off the community. And then in a very lovely way, besos y abrazos. You know, hugs and kisses. Emma. So I had his number, I called him up, I said, what are you doing? He said, well, you didn't take El Fago to Rush. And I looked him up in the computer, I said, he's never come to Rush. He said, I'll call you back. And then he says, oh, he went to University of Illinois. I said, well, why'd you go have your demonstration? Anyway, it's a little bit of an aside.
Yeah.
Because the next day,
But the Posada was against all a medical system in the state of Illinois. It was totally wrong.
The devil is the devil.
Well, we went to Roche and we had 3 plans. We were ready to take it over Roche. You know? That was our plan. But we did a Posada, and Dr. David Ansell gave us shelter. He did what really surprised us, you know, because we took the Posada like Mary was and Jesus, 2 Jewish men were saved by another Jewish man. And then we did that Posada, and Roche became, through Dr. David Ansell, as a bigger alliance with us in this fight, and the situation of El Fego and Lorenzo with Roche brought us into a bigger fight in the state of Illinois for healthcare for those without documents, because it is very sad, you know. I will tell the history how being an activist. I don't know nothing about healthcare. You know, I am just an activist fighter on the streets. To fight brought us to fight for people without documents, that they were losing their lives because the only reason that they didn't have no documents. And they've been rejected in all hospitals. The first question that when they get to the hospitals, and you are healthcare workers, you know, that ask for insurance. Do you have insurance? No, I don't have insurance. Why do you don't have insurance? Because I don't have a document. Then you don't have a right to healthcare because you don't have a document. For us, that is evil. You know, this is you cannot let people die because no documents, and I know that you are fighters for social justice also, but how we can change the healthcare system in the United States, in the state of Illinois. We started a big fight in the state of Illinois. Dr. Ansell has been our partner in this, doing hunger strike. We did 3 hunger strikes. One was 31 days hunger strike, making pressure to the legislators and also to Northwestern Medical Center, that Northwestern has been missed and continues to be one of the most moral and ethical medical centers that we have met for the undocumented community. And I continue saying, I will say it anywhere where I go, because they continue to doing the same things to many people. You know, because they are putting money over people's life and violating the ethical norms that why they became a medical center to serve the communities, and we cannot let people with adult documents to die. We as an immigrant community, especially in behalf of those with adult documents, we give special and deeply thanks to Roche, because Roche has become a champion working side by side with us. We were able to get legislation in the state of Illinois, right, for people with adult documents to receive kidney transplants. And now we have like 100, how many Roche?
A lot of people got transplanted who never got transplanted before.
Exactly. We have been able to save like more than 150 lives. You know, the people.
Just to comment on that, what was interesting about it is I was an unusual chief medical officer because I didn't show up. The security guard was outside, Loris, he's about 6'10" tall, trying to keep him away from the entrance. I said let him inside, but he had Univision and baby Jesus. I definitely outnumbered, but I actually, just knew that this was the right thing to do. But to get this, to use my own voice, to get our institution to try to do things, even though I could talk my institution to doing it, not easy to do, to get these transplants. Every one I had to beg for, and we knew we needed a bigger thing, but my asking did nothing. And it wasn't until they showed up in the front door of these institutions to get attention. One of the outcomes in Illinois has been not only was a piece of legislation passed, which the next time a Democratic governor gets in, can activate, because it doesn't cost that much. It actually costs less money to give someone a transplant than lifelong dialysis. It's completely immoral. There's a that has this legislation, but more than that, the various insurance companies giving policies to people, and then when they get a transplant, the Give the Pope, which is the organ donation group, pays for them to continue to get insurance post-transplant. And that money is paid for by, actually, the premiums by Rush Northwestern University of Chicago. That was all done because of that showing up at the door. So that was
and also Illinois has came to the model for all United States and transplants, and people is coming from different places to Illinois to get transplants, and then we are fighting now that this campaign has become national. We have now groups in North Carolina and New York that are fighting. For example, Jesus coming from, where are you coming, Jesus? From Atlanta. Jesus is in dialysis now here in Chicago because Texas let people to die. Like 3 days ago, I had a phone call from San Antonio, Texas, that a woman who was getting ready to come to Illinois to receive dialysis, she died. She passed away because she couldn't make it to Illinois. And then, thank you to Dr. David Ansell, the Roche, and the people in the community, and those who are doing healthcare providers that are with social conscience. We have achieved some of the transplants, but there is a lot of that we have to do.
Let's take that as an example.
We started off in advance.
Let's take that kind of as an example. The truth is there's a rich movement history in every city in this country, but especially in Chicago. We could do certain things that we could do because we had a David Ansell that had somehow migrated from a resident from Cook County to all these places, and we got in this position. We knew that was. We could do the thing in the legislature because we had elected this gangbanger friend of mine's sister, Cynthia Soto, to the legislature, and she became chair of the Hispanic caucus, and she was willing to go with the legislation. There's a lot of people in place. We look straying through these halls today. I saw Dr. Landaverde, who led stuff for a long time. So there's a lot of old people like me that are around. You know what I'm saying? And they're useful in the struggle. I'm old for sure. And we had the same thing in our church. Jose and I've been working. I tried to make him a Methodist, and then he became I don't know, he's been through about 5 different denominations. They can't keep him straight and stuff like that. But so we had the same thing. We had 5 people that were undocumented that needed transplants and stuff like that. Actually, it keeps on going. We got one that we brought into Rush night before that. His ankles were about this big because his liver and kidneys are not working and stuff like that. We've got straight now. We just go to the emergency room. This is Dr. David Ansell's patient. Sometimes we tell him, sometimes we don't tell him. Especially if we know he's not going to be available. So then they got to take him and stuff like that. But those are all helpful and stuff. Out of our church, really, Emil Osano and Elvira Ariano led an organization called Familia Latina Unida, which started with big status families when they were separating mothers from children who were U.S. citizens and the mothers were undocumented. Elvira went into sanctuary in our church in 2006. She was there for a year. He left and got deported. We just actually brought her back. But Familia Latina Unida developed all over the country and organized families who were undocumented to make their voice heard. But as another dynamic was happening, remember Senator Durbin here, I'm going to get to help here in a minute, but Senator Durbin had proposed something called the DREAM Act. And the idea that the DREAM Act was then being opposed, it was an alternative to the families getting legalization. So let's just take the kids, we had families coming and say, what's happening? My son is calling me a criminal. Say he's innocent. He didn't know what was happening when I brought him here. So stuff like that. And we saw within the Dreamers initially a lot of individualism. I mean, what is the DREAM Act? The American dream. People didn't come here for the American dream. They came here for what the American nightmare did to their countries that forced them out of Mexico and El Salvador and so forth. So this idea of the dreamer was all wrapped up in the flag. There's a lot of problems with it, right? So we put together an organization called La Fuerza Juventud, which combined the dreamers and the U.S. citizen kids whose parents were being deported. And we had walkouts from a lot of different high schools and different stuff like that. And we began to organize that around the country, really to try to challenge the consciousness. But I really believe that, especially in a movement that gets taken up in the press and stuff like that, that young people get forced into a kind of individualism and an embrace of a lot of things that are evil in this country in order to make their progress. And I think that the way you deal with that is through service. That is, if you serve your community, then you don't get caught up in all this bullshit about, hey, I'm an American and I'm going to be the president and I'm going to do this. You know what I'm saying? It's not all individual and stuff like this. It's not all careerist and everything. So we formed the Youth Health Service Corps. Last year we had actually 1,600 students from different high schools. And we get medical students from Rushing, there are a couple of them here. And from UIC we had, I think last year we had over 140 students. And they come and we got a little curriculum and they teach the high school students about 5 basic diseases. Asthma, and, diabetes, and hypertension and heart disease, breast and prostate cancer, HIV/AIDS. And then each student brings 10 of their family and neighbors through the screenings with the help, of the whatever medical. We got a pretty good network of medical clinics and hospitals that we have coerced into working with us here. The medical schools are very important. If you go in through medical school to Rush, you can do it a lot better than if you go through the hospital or a clinic. Because I guess the medical school get grants and they need to give props and stuff like that. So that was helpful. So that's 1,500 students that then represent 15,000 people and their parents and community and stuff like that. That's a pretty good little army. And after they do the screening, then you work on access. The question of the transplants was the most dramatic, of that kind of access questions. And in some ways I felt, I wasn't sure about that. You know, I didn't really want to put all the focus on the transplants because that's just a few people compared to thousands that die because they don't get early detection of treatable disease. I think if you look, so, you know, we continue with the Youth Health Service Corps, we tend to expand. Chicago State has kind of adopted it, and they're going to work with 5 schools in their area there. We're going to move on to the University of Chicago. I met with them. They said, oh yeah, we love the program and everything. We'd like to get our medical students, but we can't work anything out with CPS. We've been trying for 5 years. And, well, I think we can work that for you. But it's going to cut into their resources because once you get the medical students in, then you do the screening, you screen 1,000 people, and you got 500 people that don't have insurance that need health care, right? So then you force the doors open. I guess what we're saying is that whether, what is the problem with healthcare in the city of Chicago? There are places in Chicago where you don't have, the South Side has some deserts in terms of healthcare. That is, there's some institutions that are not there, have been closed down and have been neglected for a long time. But even there on the South Side, there's a lot of health clinics. There's a lot of doctors. You know what I'm saying? There's a lot of health stuff. The West Side, we got so much stuff we don't know what to do with. The largest concentration of health resources in the state of Illinois is in the Illinois Medical District on the West Side. And some of the worst health statistics in the state of Illinois are on the West Side. How is that possible? Right next to each other. You know what I'm saying? So, but how do you change something like that? You know, we were talking this morning with some people who they formed a big coalition and they had a plan for this program and they were doing their studies and everything. So like, but that ain't gonna go nowhere. But that's nice. You know what I'm saying? We appreciate you doing all the research, but you ain't gonna do that. First of all, you got not-for-profits, which is a terrible thing, because the not-for-profit goes to the state with 2 things in their hands. One, here's what we want you to do, and we want you to fund us. So which hand? You don't get both of them. You know what I'm saying? You don't get funded and get what you want to, so you got to pull one back. Well, that ain't really gonna happen. Plus, you know, I mean, look, after 25 or 30 years or 50 years of trying to get some kind of national, we ended up with Obamacare. Ridiculous. You know what I'm saying? I mean, we're not gonna trash it until after the election because we got to defeat Trump. You know what I'm saying? But after that, we gotta, you know, this thing got to be changed. It got to be wiped out. You know what I'm saying? We got to. That was terrible. At this level. At this level, you know what I'm saying? That you just, how do you really make change? Whatever change we make is because we diagnose the problem, we do something about it. What is the problem in Chicago? We have massive health resources that are all either because they're in different parts of the government or different politicians or different private associations. They're not connected. And we're not connected with them. Our patients are not connected with them. This is a connection problem. You know, it's not like we don't, I mean, look, this is not El Salvador. You know what I'm saying? Cuba got a much better health system or works better for people than we got in this country here. But look at the resources that we have in Chicago. Our people don't have connection, they don't have access. And they're not educated. Let me say one more thing about that. Why it's important for us to go to the young people to get an understanding. An educated consumer knows how to fight to get access, knows who to go to help the fight, but they also know about themselves. I want to use myself as an example. I just figured this out this morning. I go to Ansell. He says, "Oh, you got a lot of pain." You know, I said, "Right." I did. I went there. He's my doctor. So I go to Ansell and said, "I got a lot of pain." So he gives me 2 things. He got a referral to physical therapy and a referral to get an MRI and see a surgeon. Well, the physical therapy was way up north, so I didn't go there. So I came back here. I got the MRI, and I go to the surgeon. He says, "Okay, great. You got spinal stenosis. I'm going to take your spine out and put another spine in." My ass. How long is that going to take me out? A year. So I just forgot about it. After that, I did what everybody else did. You know, give me some dope. You know, and I take pills for 5 or 6 years. So finally, I was over here at Rush and here, doctor. What's his name? Who's your physical therapist, Dr. Rush? She's now in charge of the sports medicine and stuff like that. What's her name? Anyway, she's a good person. She sees me limping around and says, "Come here." And she sets me up and we go to physical therapy. And you know, today they found out you got a trigger like Kennedy has, and you stick a needle down there. I'm feeling good. You know what I'm saying? But the educated health consumer would say, "Let me do." The doctor just told me, "Here are your alternatives," and I didn't deal with it. You know what I'm saying? Our people got to get educated. We're getting miseducated. You know what I'm saying? We're getting miseducated in terms of what our alternatives are. That's why the immigrant has better health care than somebody who's been here for 2 years because we started eating poison for food, and we go to doctors and we think pills are going to treat everything and stuff like that. All I'm saying is this. It was good to, move on the transplant issue. We got a lot more people that we have to begin to move access for, and that means building connections. And look, the idea that we can just be a few activists, make some noise, and then the system will change. That's not right. That doesn't work. We need to develop our own system. You know what I'm saying? We need to develop our own system, which is a dual system to that which is empowered. So that's why I got 1,500 students. In 5 years, I'm going to have 10,000 students every year. You know what I'm saying? Who can reach out to 100,000 people, who can demand access based step by step on what the people need. And we will force change. We will force the institutions. They'll come up with legislation and funding, and somebody else will get it. You know what I'm saying? But if we're going to make change, we have to organize our dual system. And what do we need from you guys? Some of you, are healthcare providers. Some of you are students and studiers and plan. We need you to work with us. You know what I'm saying? To document the things that we do, to provide the services that we need, to find the niches of access so we can force open the doors and so forth. But dual power exists here. We have power. If we give it up and say, no, we're just part of the system and let's legislate something or let's get on a committee, nothing gets done. I'm going to tell you one other story.
Can you hold on that story for just a second? I want to actually ask, to have just people sort of say, so you're in a room full of public health people of all different dimensions and domains, from students to professors, as you said, from, researchers to practitioners. What would you want to see? If you think about the work that you've done and the movement that you've done out on the streets, demonstrations, in arrests, all three of you, have gotten arrested for doing the work they do. What would you want to see from this public health community who's interested in inequality and inequity? What would be a demand or a request you would have of them? Let's start with Alan. What would you?
I guess to understand movement work as public health, I think, first, and then to kind of see that as part of your calling, because actually, that I guess that realization came to me. We did a teach-in early on about the Trauma Center campaign. There was actually a public health student there that we brought on the panel to talk about trauma care, and to me, one of the most profound points she made was that this teach-in is an act of public health, which I had never understood that, and so to see that, just as much as what it's being said that the research, study of a system or something is a part of public health, to see that demonstration is part of public health, and to see it as just as valuable and important, and to understand that there's an equal amount of rigor to that work, and to actually make it successful and it's worth studying, and because we need more troops, we need more people involved. We need, not just people who are going to do some research that we can use. We do need that too, and we do need that support. So reaching out to see who are the social justice community organizations that might need some help and support. But also, we do need a mass movement of people, and there is movement work happening. It's kind of, I think a lot of times it's easy to feel like that's a little bit below you, I guess. That's kind of a thing I see in academic worlds, I guess, right? And so to try to shift that culture, I think, and to understand that the Black Lives Matter movement is a public health movement, right? To be able to articulate that. To say that that's the work that we should be doing, to recenter and refocus your peers and the things that you're studying and focusing the energy on towards that, I think. So that's what I would say, I think, the bigger picture, but generally the more nuts and bolts is realizing that there's movement work everywhere. In Chicago, you know, just had another police killing. There's about to be a teacher strike. You know, I was just in the CPS breakout group where they were talking about LGBTQ issues, and one of the concerns that could maybe hinder the work that they're trying to do to expand LGBTQ education was the strike is hindering. And that made no sense to me. I'm like, the strike is a tremendous opportunity to educate masses of people about the things that you're trying to do, right? So we need to see that as part of this work, right? It's not just creating a neat program that you can evaluate, because it's in these movement moments where leaps and bounds and progress are made, right? And our job is to prepare for those moments so we can seize them. So.
I just want to ask, I don't want to embarrass anyone in the room, because I think what Adam said is a really important point around public health work. And let me just, a show of hands only if you're comfortable, okay? Who's ever been in a demonstration? All right. So to me, that's speech. That's using your voice. It's got to be practiced like other things too. You know, we can't achieve the outcomes without the community demanding it in some way, shape, or form. Father, your thoughts, and what would you ask? What would you like from the public
Well,
health?
I don't want to preach to the choir because I just was in Cleveland, Ohio last week.
You walked there, didn't
we
you?
walked 370 miles from Chicago to Cleveland, and then we were there in Cleveland on Thursday. It was the 4 days of the third day of the Republican Convention. And I was so happy to see all the healthcare. It doesn't work. I was in Cleveland, and do you know that I was so happy to see all the my English is a little bit English if you don't understand it. All the healthcare centers of Cleveland all together protesting Donald Trump, where 5,000 doctors, nurses, and hospital workers marching against Donald Trump. You know, I was so happy to see that the doctors and very radicals. You know, but what I want to see from the healthcare system is that the healthcare goes beyond to the hospitals. Healthcare goes to the create an equality for all, you know. And it's not something when the patient goes to the hospital goes totally destroyed, especially those who are more vulnerable, the community with no documents, you know, and it's very painful to see in our community that the people with no documents and 26th Street, they go with El Brujo, started to go with the doctor. Do you know why they do that? Because they don't go to the clinic because they will ask for insurance. Do you know? And they are very sick. And then they decide to go to 26th Street con El Brujo, with the witchcraft, with the witch, and 26th with the witch doctor. And then when they ended to the hospital, it's because they are totally almost dying. You know that you are the healthcare provider, you know about that. When we Latinos go to the hospital, some, not all, those without documents go to the hospital, it's because we are almost dying. My example, I went to the hospital when I was having heart attack, you know, and I was ready to be open. Do you know, those without documents, they do that because, and then how we can be part of the struggle, you know. But I want to see we walked from Chicago to Springfield, right? And I was very.
I drove.
You drove. But we walked from Chicago to Springfield, 150 miles. It's very close. You know, but do you know what's happening when we get to Springfield to try to speak to the governor about the issue that we were lobbying for not to take away the money from the dialysis clinics, also from the doctors and to have money to provide health care for us because the governor was trying to take away that. You know, we didn't even meet with nobody from the governor's office. They put what the guy.
They were children. I don't know.
No. It was not even children. He worked for the animal control, something like that. The person, you know, that was very disappointing. And why that happened? Because we were not connected with all of you. Because you guys have a power. If you all those medical providers that are here organizers, they decide to do a protest against the governor, they will listen in right away. But we were people with no documents walking, nobody would care us. Just the rangers, they were very compassionate with us, providing water and when we were walking. What I am trying to say is that we need to be part of the struggle. So, you know, in Christianity we say, those who we practice the liberation theology, we say, it's one thing to take the option for the poor than to take the option with the poor, you know. We don't want you to take the option for us. We want you to take the option with us, to all work together to create the social change, you know, that is really needed. And it is an opportunity, you know, and I don't want to bring this, he brought the situation about police, but this week we are taking over, we are camping outside the police department of Coleman and Field. And do you know, and it's about healthcare also. Do you know why? Because those people in that neighborhood are tortured, are real abandoned, and there is it is a lot of things that we have to be committed with and to continue our fight for real social change. We know that the healthcare goes beyond to it goes in different ways.
I think we got to end here. Just say, are there any questions from the crowd here from the audience? Thank you, our panelists. And then we got to evaluate the day. So, any questions? All right. Thank you very much, all three of you, for coming.